right, so let's start with some breaking inputs that have just come in, with nearly about 150 cases having been reported in just the last 24 hours. The total number of cases in India has now risen to 873. The death toll stands at 19. And the state of Maharashtra continues to be the worst affected, with more than 180 cases having been reported so far. Kerala is the second worst hit state with 173 cases, and India's capital, New Delhi, has a total of 39 cases. Now, India is currently under a 21-day period of a lockdown in an effort to slow down the outbreak of the coronavirus infections. And for more on this, we are joined in by WION's Siddhant Sibil, who is joining us over the phone line. Good morning to you, Siddhant. What more updates do we have on this?
Well, Mohammed, the number of people who have been infected in India stands at 873, and in the last 24 hours, the number has increased substantially by 149 cases. So 149 cases have been reported across India in the last 24 hours. That is a spike. And that is not a very positive news. But by and large, there is another positive news. That is the number of people who have been discharged, who have been infected, stands at 78. So number has also increased in that front. So we are now waiting for the ICMR statement because the ICMR gives a statement at around 10:15 a.m. and then we'll get to know the number of individuals India has tested. As of now, by the last statement issued by the ICMR, India has tested 26,798 individuals. That is still quite less when it comes to India's population of 1.1 billion. And so India's focus right now is on testing, and for that, the Indian government is taking more measures. But as of now, today, the focus is on making sure that people stay inside, stay safe. Today is the fourth day of pan-India lockdown, so people are hardly being seen on the ground. But the big focus is now on the migrant workers, because remember, it is the migrant workers who are leaving big cities like Delhi, where I am standing, and that is a problem for them, because while they move, they are moving very close, and that can be a cause of worry in the spread of the virus.
Absolutely, indeed. Now, one of the big concerns, Siddhant, that a lot of experts have been talking about, that a lockdown per se may not be helpful in containing the spread of the COVID-19 infections. It is important to ramp up testing. At this point of time, the numbers by the ICMR in terms of the number of tests that are done on a daily basis, that is yet to be given out. We'll have that information in some time from now. But is there now a coherent change in terms of India's strategy that now we will ramp up testing, because a lockdown per se is not going to be helpful?
Well, this has been India's strategy to increase the number of people who are being tested substantially. India, in fact, has given tenders as well and is in the process of selecting the certain companies. But if we talk about lockdown, yes, there are reports. Many have seen that lockdown may not be a good solution, but it is definitely right now. As of now, it is a solution, given the fact that it's only through lockdown that people stay away, stay inside, and break the chain. But of course, there are problems associated with it, especially when it comes to livelihood problems. The migrant workers I was talking about are leaving the city. They are leaving in groups, and that can spread the virus. And also the Indian government has been saying that it is making sure that these migrant workers stay where they are. So these migrant workers will now be requested to stay inside Delhi, and they have enforced security personnel at the border in Delhi-UP border.
All right, we'll have to leave there. Thank you very much indeed, Siddhant Sibil, for joining us and getting us all those updates.